Hi, welcome to today's episode of Conversations with Karen and Kat. I'm Karen Scott Green,
And I'm Kat Hardrick.
and in honor of Breast Cancer Month, we are joined today by two survivors, Ingrid Lett and Betty Ibrahim. And Ingrid she's a retired property manager, a mental health paraprofessional, a substance abuse and alcohol facilitator. She holds a bachelor's degree, and she is a mom of two and nana of six, and a very involved member of her church, New Bethel AME.
What is that's not what's we dropping that name? What is it?
Nana.
What's the church? What's the church?
New Bethel AME in Lithonia, Georgia.
That's right. That's right.
William E. Thomas Pastor.
Yes. And Betty Ibrahim, my cousin.
Yes.
She is a mother. She is a pastor. She's a former educator and a FAMU alum.
Yes.
Welcome, welcome, welcome. It was so important to Kat and I that we do this show and talk to Black women because, you know, we've learned that Black women are disproportionately affected by breast cancer. When we do get breast cancer, we tend to get more aggressive subtypes, which is the triple negative breast cancer. We get inflammatory breast cancer, and we get diagnosed at younger ages when we are diagnosed, we have more advanced stages of the disease. So we wanted to talk to some survivors. And I know that the two of you have battled that journey. And so we wanted to talk about your diagnosis, what you went through, what that journey was like, and how you came out on the other side. And I happen to know that both of you are women of faith, you're women of God. So I know that played a lot. So I'm going to ask Betty, Reverend Betty, to tell us about how you came about your diagnosis. How did you discover that you'd had breast cancer?
Well, I was a big proponent of making sure that I got my yearly exams.
Mm-hmm.
And I went in 2009, and my cousin Deborah and I just met up with a very negative lady. So we didn't get our mammograms that year. So, of course, I came back in 2010 and got my mammogram.
Mm-hmm.
And I got the call that no woman ever wants to get and said, we need you to come back in. We want to check you again. Did that a few days later. The doctor wanted me to come to her office, and my daughter Courtney and I went to Tallahassee, and I heard the words that I never wanted to hear, that I had cancer.
Okay.
And at that moment, the only person, like I said, I had with me was my child, who was very young still at that age. And we had to drive 50 miles just to get back home. And I had to try, and Courtney knew something was going on because I hadn't told her anything. And I kept trying to play over in my mind, how do I tell my child this and how do I tell my family?
Yeah.
So I eventually told Courtney while we were in Tallahassee, and I had to tell her, baby, look at mama. And until you see mama crying, don't you cry. We got a hand on this. We're still in God's hand. Nothing has changed. We're going to do what the doctors tell us to do. We're going to get a second opinion. And we did. We went to Mayo in Jacksonville and got my second opinion. My sister Mary took me. And I think for me, having the team that I had, a family of faith and friends that just immediately rallied around me, supported me. I didn't have to worry about how I was going to get to my treatments. I live in a little town called Sneeze, and I had to drive 50 miles a day to get my treatments. But my sister there were people lining up saying, Mary, let me take her sometime. But like I said, I had a team. And because of that team, even with all the stuff you go through, I'm one of those people that's got some weird skin, I guess. After my first treatment of radiation, I turned like beet red, couldn't take it for a few more days. In fact, I took radiation from October to January because they couldn't give me high dosages. My skin turned jet black, peeled off me. It was a hard road, but at the end of the road, I knew I'd get victory. It took me a while to get into remission. I went into remission in 2015, finally, just in time to find brain tumors. But again, faith and family is all that matters. Amos, stop. If you hear something whining, that's my cat Amos. You want to go on camera? See, let everybody see you.
Oh, famous Amos. Famous
Famous
Amos.
Amos. This is Amos. And it was just, and Amos was here through it all with me. And it, for me, it was faith and family.
Okay. Okay. And then Ingrid, how were you diagnosed?
It's really funny because Sister Betty spoke about a negative doctor. I went to see my PCP. And let me first give a shout out to Grady. Grady has saved my life a number of times. And I went to see my PCP for my regular. And I
Okay.
told her, any concerns? I said, yeah, my left breast is blinking at me. And she said, what do you mean blinking? I said, it's the color around the areola. All that has just faded. Well, you're getting older now. This is a sister girl.
Oh my God.
Getting older. I said, but no, this is not normal. They've been with me
Right.
all my life. I've got one that's brown and one is no color. Something's not right. Well, your mammogram is not due to June. We'll check. I said, no, we will not wait to June. I
Wow.
want you to order me a mammogram. That was December. I had my mammogram December 26th, right after Christmas. January, 2 days before my birthday, the 11th. My birthday's the 13th. I went in. They sent me the little note on my chart. We need to see you. We found something suspicious. Now, Betty, that didn't startle me because my mammograms have always shown lymph nodes and density. So I've always had to go back. But this time I knew because I kept feeling this pull. You know, I'm a very heavy advocate for checking your body out.
Yeah.
Use a mirror. I mean, look at it. My mom always told you look at everything, moles and the whole work. So when I went in, my husband and I had gone. We were in the room waiting for diagnosis. We prayed. I was fine because I knew. You know how you know
Right.
something not right. I never said something is wrong. I said something's not right.
Right.
So when my doctor came in, Dr. Okoli from Nigeria, I believe. He walks into the room. He said, "Oh my, I feel the presence of the Lord in here."
All right.
I knew right then and there.
Awesome. Right, doctor.
I
Yeah.
was in the right place.
Mm.
He told me, he said, first, I want to ask you, how did you know? I said, because of this little pull, and I took my bra off quick, right?
Right.
I say, see how light she is, and this one is dark. He looked at me, he said, yeah. I said, that ain't right. Something not right. You know,
Right. Right.
he said, well, you're correct. You have HER2 carcinoma of the milk duct.
What is it called? Say that again, sis.
HER2, which is hormone estrogen reactive.
Yeah.
Okay.
HER2 carcinoma, which is in the milk duct. Now, what was really surprising to him is that it had not escaped that little granule, that milk duct. He said, if you had come last month, we might not have seen it. It had to be stage 0 then. I was so early stage 1.
Me too.
I'm going to do the surgery and remove it. So in the meantime, I had surgery March 1st. While I was recovering, he had taken a lymph node and did a genetic testing. And my genetics showed that my estrogen, I'm raging estrogen. This cancer was estrogen fed. So we want to do chemo. We weren't going to do chemo. I did 4 rounds of chemo, one every 21 days. And I did 4 weeks of radiation, 5 days a week. Okay. The only trauma I'm going to say anxious moment was when I had my second round of chemo and the young lady was not passionate. And she wasn't patient with me, and she just jammed it into my system.
Oh my God.
I almost had a heart attack. Almost, I really did. Everybody came out of woodwork like roaches. They just ran. Gave me a drill. Yeah, gave me a moment. So my chemo, even though it was only 4 rounds every 21 days, it took me, instead of 15, 20 minutes, mine was 45 to an hour. Because my body.
Wait, so the administration was 15, 20 minutes, or your recovery from after?
After the chemo?
Yeah, what was 15, 20 minutes?
The chemo injection, when you go in for your injection, they put the pin in and the needle in, and it's normally 15 to 20 minutes. Mine was 45 to an hour.
So were you on an IV drip?
It was. I would not get that port.
The port. Okay.
Why would I get a port? I'm only getting 4 treatments, 21 days apart. People that are getting chemo daily, they need a port because it's so harsh on the system.
Okay.
Yeah. So with
If
the chemo, go ahead.
Finish your story. I got a question. Finish your story, please.
Okay. So that was the only time, and that anxiety had me in a bad place where it shook my faith because there was such negative energy running through my mind. But the whole time, I didn't really think about the cancer. I didn't give it energy. I always tell people I didn't mind, so it didn't matter. And my journey was light. To me, my journey was not traumatic, except for that one experience where my mind kind of went into an anxious moment. It's really funny because I discovered when I'm anxious, I get jovial and I start joking around. When I'm not comfortable in situations, that's my anxiety. That day I told Shantae to go see somebody else.
Shantae. That's funny.
But that was March 1, I had my surgery. April, I started chemo. August, I had radiation. I had my checkup. This was in 2022. Yeah.
So this was right after the height of COVID. Okay.
And I was already used to staying in.
Yeah.
Right.
So I had my checkup 3 weeks ago where I've been cleared. I'm now a member of NED, no evidence of disease.
Amen. Right. Praise the Lord. Amen. Yeah.
Praise God.
Good. My congratulations. Praise God. Give God all the glory. I'm glad you ladies are healed and sharing your stories. I would like to get some clarification to understand. I had a lump removed. It was benign. And then I was below the age. What's the age that they suggest you start getting breast exams? I can't remember the age.
35 or 40.
I had my first lump at a young age. So ever since then, I had to start getting examinations. So my question is with regard to the treatment that you have, if it's comfortable, I don't want to traumatize anybody, but explain the difference between chemo treatment and radiation treatment and how that process looks. What are the steps to receive either treatment?
Because I was stage 1, and they could tell from my my last mammogram versus my 2010, they know it was at its early stage. So I chose not to do chemo. So I only had radiation.
And see, now I had chemo as a preventive maintenance, preventive measure, because when my genetics came back, on top of the 25% chance of recurrence, mine increased by another 38%. Because of my hormones, my estrogen. I mean, I had a hysterectomy at 42, but obviously I'm just flooded with estrogen. So the suggestion was, let's do the preventive maintenance.
Okay.
Yeah. And chemo wasn't, I didn't have the throwing up. I wasn't sick. I just slept. But that's because mine was four rounds, 21 days apart. You see, I didn't even sweat when I lost all that hair. I just took the clippers and cut it off.
Right. Yeah.
But
so that was chemo.
That was chemo. Radiation was uncomfortable, mainly because after the surgery, my cancer was in the back of my breast, ladies. I would have never felt that lump. It was back in the back. So the surgery scars here. And when they did the surgery, they must have had my arm. My rotator cuff was messed up for a year. Okay, so when I went to do radiation, I had to do that move that was very
put that arm behind you,
the whole time, those 15 minutes. Now my breast had a pretty suntan, Betty.
Mine then I turned as black as this shirt, and then it decided it wanted to peel off me.
Oh, So
I like I said, I was in radiation from October to January.
So
because they had to try to lower the dosages, and I was going 5 days a week. And even with that, my skin was, well, how did the doctor tell me? He said, I've got an 80-year-old lady in here taking radiation, and her skin is behaving better than yours.
Whoa.
My skin is very sensitive.
I'm sensitive skin as well, but the doctor explained darker pigmentation burn really bad. For some reason, lighter pigmentation doesn't tend to burn. I know they used a new machine on me. There was a new first I went in, they did a body mold of my shoulder and everything correct. So when I got there was I never really saw this machine. It was just something going around, laser. It was never, the only thing that was uncomfortable was my arm. That didn't hurt. Now, the blessing of this left one is brand new. She tight. She's sitting up. This one,
This
They
is
ain't
why
ready for it. She said,
this is why
that
my
sissy tight.
Well, this one, see, it sit up here so good. I mean, and then this one like poking. She looking down. She sad over here.
She a
But
trip hazard. She a trip
yes,
hazard.
baby. You know that scar tissue has real tight, and it's taking a while for the scar tissue to go away.
Okay.
Look, and I do this. I'll be in public doing this. And don't even think about it. Massaging.
Well, they said they would have never did the surgery on my left breast had they known I had a problem going on with my pituitary gland. At the time, nobody knew I had tumors on my pituitary gland, so they did surgery on my left breast to make it the size of my right breast, which had the cancer. Now I've got a nice little breast over here on the right side, and I you should see me trying to buy a bra. It's a mess. Because this over here got like 3 times the size it originally was. It makes your clothes look real funny.
Oh, wow.
And I just don't want to do another surgery because now the pituitary gland doesn't function at all. And I take a battery of medication. But they said had they known that, they would have never cut me anyway.
So, Betty, is the pituitary gland, was that because of the radiation? Did it have any connection to the breast cancer?
No. I've been having some problems for years. In fact, probably back in like 1995, I started gaining weight. Karen, I used to be very, very tiny. And all of a sudden I started gaining weight. But at the same token, I was having a lot of problems with my digestive system. Eat, run to the bathroom, the whole 10 yards. But when Black women especially go to their doctors, they do not listen to us. And I'm telling this guy, man, I've never been over 125 pounds. I'm now 140 pounds. Oh, you're just getting older. That's their excuse for everything with them. Oh, you're just getting older. And my mom would say, no, you don't understand. She can eat an apple and she gets diarrhea. Something is going on with her system. So by the time they did find that my pituitary gland wasn't functioning at all, many years later, my doctor said he's the one who I can't think of his title right now over that studies pituitary glands. He said you had all the symptoms and nobody knew. It came to the point where my sister takes me to the emergency room because I'm wearing sunglasses. My eyes can't take sunlight, and my body's shutting down before they really checked and found my pituitary gland. But because of breast cancer and not knowing, now, like I said, I've got a giant breast and a baby breast.
They make bras for the.
I was just about to say
There actually was a lady in Buckhead. She specialized in making unique bras to fit the combination because one side will be a different size than another. I don't know if she's still open or not. But it's in Buckhead.
But they don't tell you.
It's a boutique.
They don't. Correct. We have to be our own advocates. We have to pay attention to the doctor because they just treat on a general platform. So if you go in, they're going to do what they've been trained. And they're not trained to cure. Remember that.
That's it. They're not trying to cure.
They're trained to treat. That's a fact. So
you mentioned something. You said that your lump was all the way to the back of your breast.
Yes.
I had a
Amos, stop it.
I had a lump earlier this year, and you had to have it biopsied. But it was also my lymph nodes were swollen. It was up under my arm, and it was in an area that if you're doing your own breast self-exam, you don't check back there. So one of the reasons why Kat and I were talking about doing this show was also to make women aware that when you're doing your breast self-exam, you've got to lift up your arm and
move it way back.
You also got to check under your arms and get those lymph nodes because I have never and would have never checked up under my arm. It turned out it was nothing, but I did have to have a biopsy because that lymph node was swollen. But as women, we have to go beyond just the breast, to make sure that we're good.
But as women, we have this third power. And it's called instinct. There's a strong instinct. Pay attention to your body. The smallest things your doctors will dismiss, do not dismiss yourself. Because I kept feeling like there was a string pulling from my nipple. Like up towards my shoulder. I'll be driving. I said, well, maybe it's my bra, you know. Not just kept going. Was with my husband. We sitting around talking. We sitting, no problem, you know.
Yeah.
I'm sitting there. All of a sudden, I felt that little pull. It's almost like a string was being pulled here, and it's you know, like you check your glands.
Yeah.
We should check our glands just like we check here. Look at the glands, and they will swell when things are not right. So if you feel this little thing rolling around, don't just wait till your schedule mammogram. Better safe than sorry.
Yeah, you know, and that's the message that I know we want to make sure, because Karen and I were talking about this, and even you mentioned it, Ingrid. The doctor said, let's wait. You know, that is something that we encourage everyone, women and men, in any capacity of your wellness. Listen to your own intuition. If someone, a medical professional, is delaying your treatment, then it is time for you to find another doctor.
Very true.
But Kat, it's not just that. Your insurance companies do preventive measures.
Yeah.
Or basically, they have you on a maintenance schedule. You understand? So 6 months later to do your mammogram, if your insurance is not going to pay for it, you have to pay for it out of pocket. No problem. But when it comes to women's mammograms, there are so many programs. I didn't pay a dime. I didn't pay a dime for my procedures. Not a dime.
Nothing.
So
Brady was that good.
I'm a veteran and I receive benefits from the VA, and this may not still be true. So family, check my stats. But there was an executive person that said that I know I have to be outsourced to get mammograms because the VA doesn't have a machine for us. So we have to outsource. Right. So here it is. We're this ginormous medical facility that is not capable. And somebody could fact check this. We know we lie.
Let me give you a fact. Let me give you a fact that I've learned. My dad is a vet. He hated the VA because they treat you like the whatever.
Cattle.
He's 90, so I take care of him. And I discovered now, as of last year, the VA can take your benefits to Grady.
Well, yeah, they have it's called Choice. It's a choice plan. And so they've created their partnership so you can go out, because the VA doesn't have those facilities. The issue for me is, dude, I shouldn't have to go to 5,000 different places. I can see if you overcrowded and you need to create a relationship, but to say you don't have it to start with for women, veterans, that's a problem for me. But yes, you should.
That's something to take up with our legislators.
Yeah, that's a whole nother can of worms. That'd be a great.
That's another show. We'll
talk about that one in November, Veteran Month. And I'll be back because I'm a veteran also.
That's right.
Thank you for your service, Queen.
Thank you for your service.
As I mentioned earlier, Betty and I are cousins. I don't know if I mentioned that since we've been on air, but Betty and I are cousins on my father's side. And on my father's side, we've had several instances of breast cancer.
Yes.
My aunt, several of the cousins, and I have had breast cancer. Grandma, my grandmother,
your grandma,
has had breast cancer. So they always talk about. I bring that up because they always talk about the maternal side, and no one ever talks about the paternal side also having a risk, because they always want to know when you go in, did your mother have cancer? Did your maternal grandmother? But on my particular side, it's on the paternal side. And what I realized and what I read in my chart was that I do have an elevated risk for breast cancer because of that paternal connection, but nobody talks about it.
My record says no family history of breast cancer, maternal side.
Wow!
But I thought my paternal side as well. So this comes up and say, Dad, I'm going to have surgery for breast cancer. He said, oh, you sound like my two sisters.
Wow!
When were you going to tell a girl? Two of my aunts, his sisters, died of breast cancer. I'm like, he said, well, we just don't tell people's business.
Oh, Black folks need to start talking.
That part we talk about.
We need to start
talk about that all the time. We got to cut out that taboo, family secrets.
Yes.
Don't whatever happened in this house. You know, we have to do something about that, especially with the health, because it like I talk about this all the time. I lost my parents early, my biological parents early, so I don't have a straight pathway to my medical history. So I remember always going places. Do your mom have this or your father ever had this? And my answer was like, I don't know. I have no idea. You know, and then my oldest brother wound up having a glioma cancer in his brain, and he died 6 months after he literally was diagnosed. So that's our first
known
genetic, thank you, that you can actually tie. And so now all of us, you know, and then with my breast earlier in my life, that's it. That's all we have. So I say that to say, I didn't have the information for me just because death happened before we can get it. But then to have somebody that's 60, 70, 80, that's sitting right here, you having breakfast with, Thanksgiving with, or I shouldn't say Thanksgiving, but holidays with and all this stuff, then, you know, and not to have that information until it's too late. We really have to do better with that, family. We all have to do that. We owe it to the next generation to make sure we sit down and educate one another about that. You know, I do want to ask Betty, when you mentioned, if this, again, I know we're on the show, so if there's anything you don't want to talk about, please, you know, go past that. But you mentioned about your skin and how it responded to your treatment. Can you speak to how you cared for that? How did you care for yourself? How did you get back to being 100%? And what tips you can give other people? Because you're saying if it's effective to people with more melanin, and you were an exception because you're sensitive skin, what can we do when we get the treatment for chemo and radiation? How can we help ourselves go through that healing process?
They tell you to get, I can't think of the name of it, I think it was Aquaphor or something, but even that did not work on my skin.
Petroleum based, that's why.
And obviously, because when I would put it on, it would cause other bumps and things. Again, I've got some weird skin, but basically we kept it as when I didn't have to have clothes on it. It sounds gross, but I just let air hit it as much as possible.
That's not gross, honey. Shoot, we like that.
With Floyd, it looked. But for me, that was the best treatment. Trying to put oils and other things like that on it, ointments, did not work for me. It would just make it worse, make the skin peel even worse. So finally, my sister Mary, who was my primary caretaker at that time, she said, when we get home, just take it off, take this shirt off, and just let the air hit it. She said the air shouldn't make you sick. And that's basically what we did. We kept, had to just let air on mine because everything they prescribed for me did not work for me. And everybody's different. You just have to find what works best for you. But even now, I have to watch what soaps I use, the whole 10 yards, because again, just very sensitive. I can't sit, you know, my doctors got me on vitamin C because I can't sit out in the sunlight a lot. I sit out in the sunlight and I'm going to get blisters.
Okay.
So I don't stay in sunlight a lot either. I'm starting to think I may have hey, Karen, do we have a vampire gene? But
it's called European.
Yeah, my skin is it does its own thing. It does its own thing. But that's basically what I would do when I would get home and I could take all this stuff off me. Even now, I only sleep like under a sheet. Again, that's just me. And when I got home, I could take all that stuff off. And if somebody was coming to visit, we just pull the sheet up to my neck, you know. But there was no ointment that they could give me that worked for me. Did anything work for you?
Natural shea butter, African shea. No additives. Don't get this stuff with the rosemary and all of that. And I swear by it. Cocoa butter, my body wouldn't absorb it correctly. Never has.
Never would.
So I had in my cabinet a big jar of natural shea butter. I bought from the beauty supply store just prior to this. So I saw the Aquaphor. I called my sister-in-law, who's this very natural homeopathic person. Don't use that Aquaphor. It's petroleum based. So when I read it, sure enough, it's petroleum. It's not going to absorb. But aquaphor is good on the burn. That's about it.
Okay.
Or dry lips. But that shea butter, when I went back, my surgery was in March. When I saw him out in March, April, I saw Dr. Okoli, the surgeon, in August. He couldn't believe it. Wow. Because this is just a little bit different than this one. And I promise you, I got into that shea. I don't have black elbows no more. I said, it works. You know,
I'm gonna have to try that. See if that'll work on me.
I love raw African shea butter. Nothing added to it. Just that yellow.
Don't get the one with the perfume smelling all sweet.
No. Okay. Get
the stick.
I'll try that, ladies.
Yeah. When you put your hands on it, it's gonna melt, girl. Yeah.
I swear. You get it, because when if you know you got the real one, they could either whip it or leave it in its
solid state.
Its solid state.
Okay.
When you put it in a solid state, you take it and you rub it in your hand, and it gets kind of liquidy in your hand. Best thing.
Yeah. But don't wear it under your favorite top, because that oil
will mess you up.
Oh, okay. I'll use it at night then.
Yeah. I use it when I get up, when I get out the shower. Every time I get out the shower, I still use it because how pretty it's made my skin.
Okay. So I'll definitely try that.
Use shea. And the price has gone up too.
Everything is.
Don't know why.
I know everything is. So Ingrid, you said you gotten your care at Grady Health System here in Atlanta, which is the #1 trauma center here in the metro. I think in the state of Georgia, actually.
Yeah.
Especially burning gunshots. We have a little clip because you are a Grady star.
Oh my!
I'm going to share. Yes, I'm going to share.
Get that clip in, girl. We like to highlight the famous.
Oh.
Get our autograph early.
Girl. I went, they were, oh wow.
Yes. The clip is about to play, family. Who is waiting who's listening by the podcast.
I'm a mother. I'm a sister. I'm a nana. I put wife last. Isn't that sad? But anywho, that's who I am. I have a degree in counseling. I did substance abuse and alcohol. I'm a 22-year recovery from cocaine. Managed properties for over 28 years. Volunteer a lot. I love to cook. I love to read. I love to write. That's me.
Grady is what I would call the best of both worlds. It is a bona fide academic teaching hospital, but at the same time, it manages to bring that warm, close-knit community feel. And that's the kind of environment I want to practice in.
I am the breast oncology nurse navigator, and I am the communication hub between the providers and the patients throughout their cancer journey. So I make sure they understand the diagnosis, understand their treatment, and make sure they have everything they need to get through the plan.
I'm one of the oncology social workers at Grady Hospital, meaning I see people when they see their medical oncologist. So Miss Lett, I saw her a little over a year ago now when she was starting her chemotherapy. Since she was new to our clinic, I did her full assessment, and we just kind of hit it off.
Grady has saved my life more than once. And each time I've come, there's always someone that listens. I had people that treated me like a person, not my situation. Cancer talk wasn't a cancer talk. It's, well, this is what we're going to do. What do you want to do? So I've learned to be very humble instead of in control. Because I'm a cocky woman, but cancer allowed me to just rest in other people's care.
A diagnosis of cancer can be very scary and overwhelming. It's not only the fear of the unknown about a patient's prognosis, what is going to happen to me, but also all the tests and treatments and side effects that you're having to deal with. It can be very challenging. And we have some patients who go through it with a smile on their faces, ever positive, not only cheerful in their own spirits, but uplifting everybody around them. And I cannot think of anybody better that exemplified this than Mrs. Ingred Lett. She told me several times over that she loved me. And I think I want to bet that she said that to a lot of people, but I know she meant it every single time.
She shared with me when I checked in with her when she had her first chemo, and she was just like, I'm really nervous. Fortunately, I had the time to sit down with her for about 30 minutes and provide some counseling with her. She had a hard treatment, but she did it with grace, and when she needed help, she asked for it, and we were able to support her and coach her along the way. It was easy to walk beside her in her cancer journey.
I met Miss Lett and her husband when she was first diagnosed. I have been with her for every stage, and I love her because she is very open and she listens to what the providers say. She incorporates it into her life. If she has a question, she doesn't hesitate to call me. So we were like extended family. So it's like taking care of a family member.
Everyone that has worked with me through this and assisted me through this has given me more than hope. They've given me enlightenment that you're not alone, even in something you don't understand. These people around me understand it. Grady has your best interests at heart.
Ingrid,
love it.
I
Yeah,
love it. I love it.
that was nice.
I still get teary.
Yes.
God in you.
Mhm.
And you know, when we did that, when they did that interview, it was an hour long. And the first thing I said, they said, what is the best thing that's happened in this journey? I said, God never left me. Everything I said about God, they faded out. But I hope you saw his spirit in me the whole time.
Yeah.
And the people around me. And I know it's political, but it was God. You know, it wasn't that it wasn't that I forgot about my husband. I was so thankful. That was the big thing I shared with them. I said, you just don't know. This God brought me out of cocaine addiction. I knew he could do this. There was no doubt in my mind because this wasn't my choice. When I chose to mess up, he stood by me. So to go through this other thing, I think it wasn't even a test of my faith because there was no question. I'm like, God, I know you. I ain't got no issues.
Okay.
Yeah, but that Grady thing was a surprise. I did an interview and I was invited to the gala. They raised $2.5 million that night for the oncology.
Awesome.
And they showed my interview, and I'm part of their brochure thing, girl. I'm like, I should. Okay, God, I did right. I went on the spirit line. I should have said, "What a check," but I would tell you, they paid utility bill. They gave me $1,000. I got. My social worker gave me everything from every breast program that's available. There's so much money out there, and our sisters don't get it. You understand what I'm saying? If you're not with the right people, you're not going to get all the things that are out there for you. You know,
how do we get that? How do we get that? Let's point us in the right direction. Let's give information before we wrap it up.
There's so many cancer grants out there. You hear Susan B. Komen all the time. But even Grady, I can't think of the name of. Oh, see, that's information I should have pulled. There was a service that if you need your utilities paid, well, I didn't. Well, let us pay one. You know, they wanted to pay my utilities every month. I didn't need it. I mean, you know, I got the check for $500. They sent me another check for $500. Well, of course, I blessed other people.
Absolutely.
But
you got this through your Grady Cancer social worker.
Yes, ma'am. Okay. Yes, ma'am. She told me, ask what is there out there. She's like, what do you need? They ask me all the time, are you eating at home? Yeah, I mean, you know, you're being mistreated. No, you know, I got a lot of care. Are you by yourself? I didn't have a big team, Betty, because my husband said I got it. He was the door watcher, the food preparer. He came in so much. I said, if you ask me, do I need anything one more time?
Well, Karen will tell you that. Well, Karen will tell you our family is, if you say one of us got a need, everybody's going to chip in. Like I said, it was 100 miles a day to go to Tallahassee and back. And my sister Mary was taking me to my treatments, and not just family members, but the entire community was, do you need me to take her? I can sign up for days. And Mary was like, no, I got this. But I live in a community that if they got a cow, I got a cow.
That's right.
We go all eat beef.
Yeah. See, I'm only 12 minutes from Grady.
So what Betty didn't tell you is that in Sinai, which is the community that our family is from,
Yeah.
literally everybody is related. So,
That part too. I wasn't gonna tell them that part. They want to know if we got 6 toes. But yeah.
He's stupid. God related the right way.
We're related the right way.
I had a lot of friends in my family. They all want to help.
Yeah.
And as I said in that video, for the first time in my life, I rested in someone else's hands because I've never allowed myself to be in someone else's care. You know, I've always cocky, you know, you're the one that does it. So my kids, my son would call, they don't handle well when I'm down because, you know, but my husband was my everything. Between God and my husband, I didn't need much. Being still was that season was a lot to learn to truly be. I didn't have to get up and cook. I didn't have to go down to the church. I had to do dishes. I had to do anything, and it was trying. It was really trying at times, but
because as Black women, we never give ourselves the luxury of just being.
We don't give ourselves the permission.
I was just about to say,
just be still.
Yep. Regardless of how we feel, we keep going.
Yeah, that was your mission. God wanted you to let someone else. He said, I got somebody else to take care of my child. You just sit still. And like you said, God has brought you through crack. You know, girl, bye. You know what I'm saying? So,
what hospital did you receive your care in Tallahassee?
Capital Regional Cancer Center.
Okay. And did they have access to resources like they do in Atlanta?
I don't know, Mary. Hey, we didn't even inquire because, again, the goodness of God, my needs were already met. And the agency I was working for, I worked for the Department of Defense, Department of Justice. And they were already saying, Mary, if you don't want to take her, we'll have a driver there every day to take her and bring her back. So we didn't have those resources, but God provided like he always does. Of course, you know, Mary wasn't going to let anybody do it but her. So my cousins got a chance every so often to take me, and they were like, Mary said, we have to do this. And they were like, because I want to be able to bring you again. And if I don't do everything she said, it's not going to happen. I had an awesome team. And I tell anybody, the team is what you got to have. And I don't mean just your medical team. It's the outside team, too. You got to have a full team. And I did, because even family members would stay here at the house with me some nights and put up with Amos. That's a story for a different day.
Not famous Amos.
Famous Amos, it will be 12 this month.
Wow.
It will be 12 this month.
So you didn't have social workers. They didn't have social workers in the cancer.
They had social workers, but there was no reason for that. You know, I saw them when I was in Tallahassee, but none ever came to the house. I think Mary kind of intimidated all of them.
Well, mine didn't come to the house. They just made a point to see me when I was
I would see them at the center. I would see them at the center, but the outside of that, Mary can be kind of intimidating. It was like, you tell me what to do and I'll do it. And they sort of said, okay, Miss Flowers. But I had an awesome team. I could not have made it through without a team like I had, and a family that was always checking in on me. If I had a need, they wouldn't have let some outside agency come in anyway. My family would have just closed ranks on us. Anyway, Karen, I tell you, we're very close knit. And if you got a need, we all got a need, and we're going to chip in and make sure that you have what you need. And for me, I could not have made this journey and come out on a positive side without the team that I had in it. And you know, as a minister, my faith was my ankle. You know, it was like, okay, God, you don't bring me through anything that you won't bring me through. And I recognized even then that I got a big mouth, and he knew that if I allowed not give Betty cancer, but if I allow cancer to touch Betty, Betty will tell the world that, hey, here's what you need to know about breast cancer wellness as Black women, as women, and here's what you need to do. And I'm a big advocate of going out, not just in the month of October, but 12 months a year, letting people know that, hey, do your self-examination, get your appointment, don't skip your mammogram. And if you need me, call me. And everybody knows that I don't have a time that you can call me. If you call me at midnight, I'm good. Yeah. I'll go to sleep afterwards.
I consider being a patient advocate. One of the nurses had asked me to consider it because each time I went in, I couldn't just sit in that lobby like it was a gloom. You know, women would be sitting there, you know, just hunched up. I'm like, what's wrong with you, girl? I don't know what I'm gonna do. I said, well, you're doing the right thing. You in the right place.
That's
now,
right.
Let's remember that we got up on this side of the dirt this morning.
Okay.
And we're still able to breathe. I said, you able to be concerned. And don't you know you cannot lean to your own understanding? And I'll go into that. And one lady in radiation, she would make my radiation appointment half an hour late because her anxiety was so bad. I could tell whenever they said, Miss Lett, they running late. I said, Jeanette in there. How you know? I said, her anxiety. I know that's what it is. But she came out one day. One day I went in earlier than her. When I came out, she was there looking like gloom and doom again. So I just hugged her and started praying in her ear and telling her, you're letting this thing get the best of you, but you got to get the best of it and kick it to the side. So they saw me doing this with women. Each time I was there, lifting them up and come in and start praying. You know, I refuse to let this thing get me blue. Like I said, when I'm anxious, my anxiety is that jovial. Yeah. You know what I mean? So they don't know how much they helped me in the times I was trying to help them. And I really thought about being a patient advocate. We need to advocate. Yeah, it's not too late, but my plate's so full, Karen.
Yeah, that's true.
Yeah.
Well, Mary did what you would do. She would go in there and the people that was sitting around with me, I was reading a book. Everybody know I love to read. And Mary would be encouraging them, sitting at the table. She'd bring puzzles for them. Just like, this is just a staging. It's just a bump in the road. You're gonna be all right. And they would look for my sister if I came in first, they were like, where's your sister? I said, she's coming. She's just parking the car. So Mary was a lot like you, was an advocate and an encourager. Because a lot of people didn't have a team. And if you don't have a team, I really do, it's got to be harder. But I had an excellent team, and you, like my sister, I think both of y'all will talk to a tree if it stands still and encourage it.
I walk with it if it moves.
Yeah. Well, you're like Mary. Mary was one of those that has. This is just a treatment center. You got the trust. You put a smile on your face. Your body's gonna react to. And me, I was sitting over there reading the book, waiting for him to call me back.
You know, I'm like, we serve a good God.
Yeah.
You don't know. Let me just give me a minute. I'll tell you my story. I promise you. You're gonna be okay.
Yeah.
It seems like the important takeaways that we've learned this evening is one, you must do your own self breast exams.
Yes.
Make sure you're getting up underneath that arm.
Yes.
You know, get up underneath that arm. Make sure you are doing your yearly mammograms. And for Black women, we may have to start those earlier because we're getting breast cancer earlier than in other groups. And if you are diagnosed, educate yourself to figure out what your treatment plan is. And if you need to get a second opinion, get a second opinion.
Don't Google. Do not Google.
No, don't Google.
Don't Google.
Don't Google.
Get a professional second opinion.
No, professional Googling.
A professional second opinion. And you need a support team.
Write down every little thing you notice before your visit, because you'll forget when you get there.
You will.
If you see a mold that was never there and it became problem, write it down. If you had a headache that just would not stop, write it down.
Write everything down. Discuss everything.
Date time. And then the other thing is ask for support resources, because every location, no matter where you are, you may have the same type of support that Grady Hospital has here in Atlanta, or you may, but only way you want to find out is if you ask. So please ask those questions. They may be able to help you with utility bill. They may be able to help you with transportation. And if nothing else, they'll be able to give you resources that you can go out further. What we got up here on the screen, Karen?
So this is just some facts, because we
operate in the lane of facts,
listen,
girl.
We educate and we entertain. In the U.S., a woman's lifetime risk of breast cancer is 1 in 8. Breast cancer has the highest mortality rate of any cancer in women between the ages of 50 and 29. African American women have a 31% breast cancer mortality rate, the highest of any U.S. racial and ethnic group. Among women younger than 45, breast cancer incidence is higher among African American women than white women. That's why it's so important to make sure that you are getting your exams, your mammograms. Younger women in general and African American women in particular are more likely to present with triple negative subtype of the disease, a subtype that is both more aggressive and associated with higher mortality. So again, we have to get to the doctors. We have to get our exams. And over the past 20 years, despite the universal drop in the mortality rates, there's been a rise in the increase of breast cancer in African American women. So products to watch out for: skin lighteners, bleaching your skin, hair relaxers,
which AKA perms,
hair relaxers, perms, Brazilian blowout treatments, and ladies, acrylic nails.
Acrylic nails.
Those are things. This is not Karen saying it. This is
research.
This is the research.
Cite your source.
This is the research. This is from,
because we want people to know we ain't pulling this out of the Cracker Jack box.
Yeah.
All right. These are facts. And all these things while sitting looking that up, you know.
This is from the Breast Cancer Prevention Partners.
And with so much pressure on women to try to, and I think we said this at another podcast, but it's so much pressure for women to look like we're frozen in our youthful stage, 16, 28, pick a number. And we do all these things to ourselves to either look a certain way age-wise or to assimilate to a whole nother group of people in order to survive. And all those things that now, which I think people have already known, but they can't hide it now, it's damaging to us. Our hair, from all those perms and all these nails everybody's saying to go get, and fingernail polish, all of that. It is killing us, from feminine products that we use on our bodies, from ovarian to hair, all of that. So we need to start paying attention to more a holistic treatment of how we care for ourselves. Like Sister Ingrid said, just use plain old, try and see if you can use African
shea butter.
Shea butter.
Yeah.
You know,
and the deodorant, we have to move away from antiperspirants. They have that silver night. What is that in there? That magnesium.
I know what you're talking about. Yeah, I don't even use deodorant anymore, girl. And you know what? I use Black African soap. You know, I get my soap from Remy Soaps, another Black-owned folks, and we dropping names. And it works really well. And you know, I may start feeling some type of way because at first you're so used to using antiperspirants, but once you start getting the hang of it and your body agrees with it, because I'd rather use something healthy that's not going to cause all these lumps and so forth under your armpit than to sit up here and now you're sitting in here worrying about a condition that
waiting on results of a biopsy.
Also, too, I signed up with Morehouse is doing
School of Medicine.
Yes, a lifetime partnership with patients who have or may be at risk of having breast cancer, because the numbers have risen. So, as you said, with us, with sisters, we are, and I'm totally convinced that it's stress. I'm totally convinced that it's stress. Totally.
Would you like to add diet? What about diet?
Your diet makes
diet is important, very important.
You know, we're eating bad, then we're dealing with things that are just humongous. I think
generational untreated trauma.
Well, and we also worry about how we look. Come on now, look in the mirror.
Let's talk about it.
You know, stop being insecure. I wasn't born with window shades on my eyelids, so I have no need to have them.
Facts.
That's another topic.
Because
I'm real serious about that. I meet women because I've gone through so much. It took me years to recover my self-esteem from my drug addiction. I'd be darned if somebody looking cute at me gonna make me go back into a whole nother addiction.
That's true.
See, that's the strength God gave me, because God told me how much I am to him. I'm his child. He loves me. There's nothing I can do to make him not love me no more. And he made me perfect. He made me unique. I run my mouth. I just mess with people. That's how he made me. He'll calm it down a little bit. I'm 65 in January. I don't know if it's gonna ever calm down. What you think, Minister Betty?
Well, I'll be 69 my birthday. We just begun.
Okay.
Hey,
watch out, girl.
That's right. They're not ready for it, but we just begun.
I love
enjoying every day of it.
Yes,
I know that's right.
Yes.
So I have to ask both of you, how long has each of you been cancer free, and do you have to go for any follow-ups periodically? Betty, you first.
I go every year still. I went into remission in 2015. Cancer was found in 2010, but that does not mean that I do not skip appointments. Okay. I'm an advocate of self-examination, but I also go and I get that mammogram. I'm going to get my physicals. My sister and I get up every morning at 5 o'clock. We walk for a mile and a half. Why? Because we want our senior years to be as good as our teen years.
Amen.
So we're doing our part, and that's what people need to understand. You've got to do your part. And being a Southerner and a country girl, we were raised on certain foods where, guess what? I don't eat those foods now. I eat a lot of fish. I eat a lot of vegetables. I eat a lot of fruits. Why? Because I want my latter years to be my better years. And to do that, I've got to take care of the house that my spirit lives in.
Hey,
I love that.
Right.
No, she didn't just preach.
I know, right?
Girl, you know, every opportunity.
I'm on the hormone suppression pill for 5 years.
Okay.
So I will continuously be under care. I don't go every 3 months now. I'll be going every 6 months.
Okay.
But as Sister Betty just said, I mean, you have to get that body moving. The body in motion stays in motion. That mind is a very important thing. Don't dwell on illnesses. Get through it.
No.
That's right.
I don't have any more treatments. I'm cancer free.
Amen.
They knew that from when they did the surgery. It's just I'm doing it because of genetics.
Gotcha.
As cancer that's fed by estrogen is a risk.
Okay.
Because we're women. We have estrogen. So I stay away from those foods that I don't do any soy products, any steroid things, you know, because they increase the possibilities. I have to remind myself I had cancer.
Hey,
I really do. When I get tired or I have a brain fart because of chemo, I still at times I'll be talking, I'll just forget what I was getting ready to say.
Chemo brain, they talk about.
Yeah, chemo brain. It's real. It's real. It's real. Mood swings, but my diet has a lot water. Drink lots
of water.
Yes.
Okay.
We should
be doing that anyway. Yeah.
Anyway, well, also chemo wiped out all of my. See if I got the word calcium. Vitamin D, because it flushes you. It's worse than the antibiotic.
Oh, wow.
So doing the treatment, protein. I did a lot of protein shakes from like pea protein, natural protein products. A lot of protein. I take vitamin D.
Me too.
You do calcium. I take D3, Betty. That's the one that has a little more.
I take 10,000 milligrams a month. I take it twice a month. 50,000 milligrams twice a month.
Oh, okay. I'm on one twice a day, and it's 1,200 total.
Yeah, a total for 100,000 for the month, but I only take the pill at the beginning of the month and the end of the month.
So it did have some mental effects. It did kind of wipe out brain cells, so I'm still regenerating. And he didn't tell me that to the end, because I probably wouldn't have done chemo if he had told me that. You know, but the body is God created an amazing machine.
He did.
Amen.
He gave doctors the power, you know, the strength to do what he has for us to do. So it's being more conscious of who I am, but I'm loving my life. And the last thing I wrote to you, Karen, was this thing has taught me changes come every day.
Yeah.
But the day that you're notified of a change, a lot of things change. Circumstances cause change. And we've got to be better about how we live each and every day.
Absolutely.
We got to be. Because
that's right.
Yeah.
Yes, honey. You done made a couple t-shirts up in here, lady, Betty and Ingrid. I mean, you like don't dwell, get through, you know.
Mine is stay the course.
Stay the course.
Stay the course.
Yes.
Stay the course.
Yeah, that's it. My thing is, regardless of what I'm going through, I recognize that God is my head, so I stay the course. I keep my eyes focused on Him and stay the course. Whatever I'm going through, He's doing the leading. All I got to do is follow.
You know,
Nehemiah 6:3.
What they tell a control freak? What they tell control freaks that we can be? Why worry about things you can't change?
Cannot change.
And change it.
Oh, Daddy used to say that worrying is like a rocking chair. You can keep on doing it, but it gets you nowhere.
That's so true. I like that.
T-shirt.
I like that.
Yeah.
T-shirt.
That was George Scott Sr. I think you got that from Grandma Georgia. But with that, ladies, Betty and Ingrid, thank you so much for sharing your journey.
Thank you for
having me.
Yes, thanks for inviting me.
This was so important that we talk to women about breast cancer awareness and things that they can look for in their own bodies. That, you know, this was an important conversation to have. And we have a comment. Susan Hines says, "Stay the course." That's a power word.
I know that's right.
It. Yes. And Kim Scott says, "Great show. Thank you."
Thank you.
Thank you, Kim.
Thank you for joining us today on this episode of What you want to say, sister?
I know, right? You see me like, please wait. I want to give a shout out to all of the husbands and support systems because Ingrid said her husband held her down. So let's not forget about our great men that are out there supporting our great queens. So we want to give shout out to our kings and our support system. So I have to say that. And that's right, Brother James. That's right.
I was going to say, you know.
Hey, whoa. Let me tell you, we don't give our men credit when credit is really due.
That's right.
They say a happy wife, happy life, happy husband, happy wife.
Yeah, very true.
We have to remember when our husbands are taking care of us, they're going through, because you know they big babies, you know. So they don't know how to say they're concerned. They just stand tall, but they go through some stuff. I know mine. I have to watch him. Yeah. And I ain't gonna hold you long, but I didn't tell him for a week when I got my diagnosis because I didn't know how he was going to take it. Well, I sat with God for a week. That's what I did.
That's right.
I sat with God for that week. And so when I told my husband, the Spirit delivered it and he took it. But I saw it. I saw him shaking. I saw him shaking.
Yeah, that's why I couldn't let us in without giving a shout out to the men in our lives and the family and friends and loved ones who support us through this entire journey. So I wanted to make sure I say that. So thanks. Big shout out to our support system, whatever that may look like. All right, Karen, I think I'm done now. I'm done.
All good. All hearts and minds are clear.
Yes.
Thanks for the invitation.
You are very, very welcome. Thank you for sharing. And as always, to our listeners and our viewers, thank you for joining us on this episode of Conversations with Karen and Kat.
Well, we are impacting the world one conversation at a time.